One. Hello, I'm Dr. E.W. Emanuel, the president of the Medical Society of the District of Columbia. Welcome to Washington Healthcare on Wednesday, or WOW, MSDC's weekly program devoted to informing and connecting the Washington, D.C. physician community. On this session of WOW, we bring you an important topic of men's health. On average, men pay less attention to our health than the average woman. Compared to women, we're more likely to drink alcohol and use tobacco, more likely to make risky choices, and more likely not to see our physician regularly. We have Doc Winston, a urologist at the Mid-Atlantic Permanente Medical Group. Welcome to you, Dr. Winston. Can you introduce yourselves to the group?
Thank you, Dr. Emanuel. Hi, everyone. My name is Doc Winston. I am a urologist who is doing a lot of work with men's health and underserved and underrepresented populations. And I'm happy to join everyone today for this important discussion.
Okay, thank you, Dr. Winston. Tell me, what factors contributes to men declining health?
I think that you hit the nail on the head. A lot of the factors that contribute to men having suboptimal health are a lot of societal factors, such as men generally do not go to the doctors as often as women. Some of that has to do with societal expectations, the He-Man complex that, oh, I don't need to work, I don't need to go to the doctor. This little ache and pain will go away, or they're just too busy. Another factor that can contribute to men's health not being as good as it could be is some of the other behavior that men tend to engage in more than women, such as more alcohol abuse, which is basically having more than 2 drinks at a sitting. Also, increased drug use, and those things together just becomes a perfect storm that really leads to increased rates of heart disease, diabetes, and death.
Do you think as the different generations are maturing, do you think there's a change? Have you seen a change? Are younger men recognizing that they must pay more attention to their health rather than their car, so to speak?
I think that there's some generational change. I think that particularly, with the use of social media, also with this paradigm shift of men being encouraged to speak up more and recognize their feelings and their emotions, that I would expect that the Generation Z and the millennials, as they age, that there may be some differences in the way that they engage their healthcare. But also, I think a factor that we need to keep in mind is that some of this is socioeconomic. I think that, let's say, in a region like ours, in Washington, D.C., with this setting, that men are socialized a little bit differently, and I think that they will, those changes will prompt them to be more engaged with their healthcare. But I think that I don't expect it to be a significant shift. I think that, as men get older and they get more responsibilities, that some of these behaviors are just hardwired. And I think that that's where us as healthcare professionals will need to come up with some creative solutions to increase those channels and to get men to pay attention more to these areas.
All right, so I'm glad you said that. Let's stay there for a minute. How can we as physicians break through the lack of awareness, the inadequate health education, the unhealthy work habits, the tendency not to seek help? How do we break through that and help that population engage more?
I think that's a $1 million question, but I think that it has to be a downstream and an upstream approach. In terms of downstream, if when men come into our offices, I think that we need to just ask, like those questions. I think we all get busy, but we need to, even we're specialists and they're coming in, if guys are coming in to see us, I think just taking a minute or two just to ask about like how is stress in your life? Are you eating okay? Just to like ask those questions so that at least men can start thinking about it, or if they're having questions about it, you can direct them into different places. Also, I think that another another tactic would be actually videos like this, because a lot of men will the men who do care about their health, they may not want to actually engage the healthcare system and traditional channels. They may be Googling, and you can there's data that shows that people are going to WebMD or Reddit to get like their medical advice, and I think that we need to be present in those channels so that we're hopefully providing good information to men, and then hopefully if they see us and hear from us or see our names, it may attract them to come see us in person or even on a video visit. And then a final tactic to consider is that if men are not coming into the centers, chances are their spouses are. And I think when their spouses come, that just asking a side conversation, just maybe once a year, saying, "Oh, how is your spouse? Are they getting their regular checkups?" And then that spouse will go to their husband and then get them into the office. I know in my practice, I have a lot of men that come in, and when I ask them like, "How did you decide to come today?" A very common answer is, "My spouse made me come or made this appointment for me." So I think those are just some tactics to consider.
I would agree with you. Thinking innovatively and outside the box. I take the opportunity when I see pregnant women to, especially at the time of a tetanus shot, to invite their husband, especially if they're a Kaiser member. And I take the opportunity to vaccinate them as well if there's a gap. I also then take that opportunity to stress the importance of them seeing their physician on an annual basis. On that same note, moving with age, tell me, what health issues come with age and what can be done to prevent or mitigate some of their effects?
Sure. So for men, I think that the two, as a urologist, the things I typically see the most are one, enlarged prostates, and then two, erectile dysfunction. In terms of enlarged prostates, a fun fact is that every man's prostate will begin to grow again around the age of 40. And as that prostate grows, it will change the way people urinate, and they may find that they're urinating more often. They may find out that your urinary stream is not as strong as it used to be. For the more severe cases, men may find that they can't urinate, or they begin to develop urinary tract infections or see blood in their urine. And when those things happen, it can be distressing for a lot of guys. In terms of what to do to prevent this, there's nothing to stop this process from happening. It's like asking, is there a way to keep me from having, gray hair? A lot of this is genetic, but what to keep in mind is that if you get to the point where you're pushing too hard to urinate, if you get to the point where you're getting up multiple times at night, it's probably a good time to see your primary care provider or a urologist, just to kind of, make sure that nothing more serious is going on. Why this is a concern for us is that as the prostate enlarges, if it can quietly begin to block the bladder to the point where the bladder stops working, or worse, it can cause the kidneys to work too hard and can lead to some kidney issues. So I encourage patients and my families and friends that, when you're noticing differences in your urinary stream, at least check in with your doctor to kind of make sure everything is moving okay, and to get to stay on top of it before it become a problem that there's no solution. In addition to enlarged prostate, erectile dysfunction happens as we get older. It is very distressing for most men. When men come to see me about their ED, I ask them, do you remember the first time that your function was off? And most men can remember that time. And it is very devastating and stressful and anxiety provoking when it happens, particularly when it happens again and again. Unlike BPH, there are some natural things that every man can do to basically attenuate erectile dysfunction, and those things are simply the things that you should be doing to kind of just have this general good health. One is regular exercise, even if it means just walking for 30 minutes most days of the week. That is going to make a difference in your overall health, and particularly your cardiovascular health. Also, keep an eye on your blood pressure and being screened for diabetes. Hypertension and diabetes are the primary culprits for most erectile dysfunction. In fact, I have a lot of men that will come see me for their ED, and while I'm evaluating them, I find that they have hypertension and they're diabetics, and they didn't know, and they get kind of annoyed, like, well, doc, I'm here to talk to you about my erections. I'm like, well, sir, your erections are married to your blood pressure and to your sugar levels, and so it becomes like this back and forth, and with educating and then helping them to understand that that what you eat and your physical activity can affect the erections. In addition to those two other factors, stress is also a really big factor with erectile dysfunction. Our body, we all experience stress, but when the body becomes overstressed, that actually makes it more difficult to have erections. So I also encourage men to identify your stress and try to keep it under control. If you're working too much, get some time off. If you and your spouse are having difficulties, you may want to get some couples counseling. But those are like the natural things that can help with erectile dysfunction. Obviously, if those things don't work, we do have plenty of medications that can be of assistance.
Thank you. We're in an age, thankfully, that well-being prevention is at the top of most people's forebrain. When it comes to men, and let's take erectile dysfunction first. Once they get to the doctor, we know that there are effects. Some effects are permanent, many can be reversed. How do we prevent these situations? How do we get the word out? How do we get men to pay attention to their erection before it becomes a problem?
I think that a strategy that I have found effective in my practice is that when guys come in with with this condition, I ask them, like, well, what brought you in? And I will tell you that most of the time what brought them in is another man. Not meaning that's someone that they're sleeping with, but a friend, a colleague, someone in their immediate circle had talked about that, hey, I'm just not getting the results sexually that I used to, and they'll end up, one of their buddies will talk to them about it on the basketball court, in the barbershop, on this golf course, and then one of their buddies will give them one of their little blue pills, and then they come to me wanting to get their pills themselves or further evaluated. So I generally encourage all my male patients, or all my patients, to really talk about your conditions, talk to your family, talk to your friends, because chances are other people are going through the same thing that you're going through. And I think as people, it's nice to know that it's not just raining on your house. Also, it's nice to know that other people have gone through something similar and have survived it. I think that gives you some perspective, gives you hope. and it actually ultimately gets you into the doctor's office to, to take care of the problem.
Oh, so we are our brother's keeper. So let's move into what you mentioned before, BPH, benign prostatic hypertrophy. Is there screenings for that?
There's no, in terms of screening, there's no formal like blood test that needs to be taken. I think the biggest thing is like if you go to the restroom and you feel like that you're the last person to leave when you're urinating, that could be a sign. If you feel like that your urine stream is very slow, that's another sign of an enlarged prostate. If you get to the point where you go like you're having accidents, that's another sign you should come see a urologist. If you ever see blood in your urine, you should definitely go see a urologist or even go to your urgent care setting. But those are really the big things. We occasionally, when you come into the office, what we'll do is have you urinate, and then we will actually use an ultrasound to see how well you empty your bladder, also to see how big the prostate is. Depending on the patient, you may need to get a digital rectal exam. That exam is on its surface is very uncomfortable for a lot of men, but it can be very necessary to save your life.
Should primary care physicians regularly perform rectal exams without complaints or signs and symptoms?
It's probably not necessary for that to be regularly performed. I mean, if there's specific symptoms such as burning with urination, blood in the urine, pain in that groin area, there may be a prostatitis, which is an inflammation of the prostate. Those sort of symptoms would prompt a digital rectal exam.
Yeah. It's interesting because as a gynecologist, I was always trained and taught that a regular annual pelvic exam was necessary to find pathology. But the evidence is showing without complaints, it really doesn't contribute. However, when a woman does have complaints, a pelvic exam can be very beneficial, informative. And I'm hearing that the same with a prostate exam. Let's move into prostate cancer. How do we screen and when do we screen for prostate cancer?
That is that's been a very controversial question for a couple of years, and depends on who you ask, you may get different answers. So I'm going to answer.
Wait. When you say who do you ask, do you mean the USPS TF or the Urology Association? Who are we speaking about?
I'm speaking about the recommendations coming from the urology community versus recommendations coming from the United States Preventive Medicine Task Force. There's a slight divergence on the general recommendations based off of some research. I won't go into the nuts and bolts of that divergence. What I will say is that prostate cancer, outside of skin cancer, is the most prevalent cancer that men experience. 1 out of 8 men will get prostate cancer in their lifetime, and some of those men will die from prostate cancer. And particularly in men who are African Americans, an underserved populations, they tend to experience prostate cancer more often and more severe. So in terms of screening, I think that in general, every man over the age of 45 should at least have a screening PSA to see what their baseline is. And if they don't have any known risk factors for prostate cancer, such as being of African descent, having a family member who's had prostate cancer, and they have regular access to medical care, at that point they can make a decision to get screened every 4 to 6 years after their initial screening. If a patient has had a family member, be it a brother or father, who's had prostate cancer, if they're of African descent, or if they're in an underserved community or doesn't come to the hospital to get medical care very often, those people should consider getting screened every 1 to 2 years. But I think that ultimately it really should be a discussion between the patient and their physician to determine what's going to be the best screening for their situation.
Okay, so I understand, and I think many people understand that there's a higher risk in the African American community. Now, when you say underserved community, we're talking about economics, we're talking about deserts. What are we talking about when you say underserved communities?
Underserved community are those communities who generally have either decreased resources for basic health care. So that would be some rural areas that would be inner city, southern vulnerable populations such as newly arrived Americans, LGBTQ populations, Native Americans. Those populations tend to have be entering the healthcare infrastructure less often. And then when they do enter, they tend to face a little bit more discrimination than other communities. So for those populations, they should have regular screenings just so that they don't get lost to follow up.
Okay. So it's more or less the lack of consistent health care rather than being, for example, well, we do know there are genetics in the African American community, or we're finding out, but the other undeserved population, the foreigner who may not be of African American descent, you're saying is at risk because of access to healthcare.
Yeah.
Okay. Well, let's move then into lifestyle habits. What are the most common lifestyle habits contributing to the declining men's health?
I think it's those things that we discussed about earlier. Not going to the doctor, not getting regular exercise, alcohol and drug abuse, and then just high stress levels. All that becomes a perfect storm that can just compromise erectile function. It can cause stress on your bladder, cause you to urinate more, and also it can just lead to hypertension, diabetes. And then it can lead to depression. While women typically experience more depression than men, men, if their depression get bad enough, will be more likely to die by suicide, which we know depression is a road to that. So it's very important that men take take ownership of their stress, and if they're feeling anxious or they're feeling depressed, that's something that shouldn't be overlooked. They should reach out, talk to a friend, or talk to a behavioral health professional. Since COVID, it's been a little more difficult to get access to professional health professionals. So even talking to someone you trust, or for some people even going on going to social media can be helpful, just to kind of find an outlet to really engage and talk about their feelings and emotions, because those things can really just overall have a major impact on the general health.
Are there resources for men to, i.e., screen for stress or other mood disorders?
There's a couple. I will let our behavioral health colleagues follow up with that. But there's if you talk with your primary care doctor, that can be an easy first step, and they can help direct to resources that may be available in their specific area.
When men present to you with erectile dysfunction or BPH, do you encourage them to be screened? Is there a screening that takes place for depression or stress, overall well-being?
Well, I generally, when they present to me with any of those problems, I definitely do just ask basic questions. It's not that sophisticated. I ask how's life going? Are you feeling stressed? Are you feeling happy? Are you sad? Are you doing things that you like? You'd be surprised that when you ask those direct questions, patients will answer. They will answer truthfully. And that to me becomes a key, that then directs the conversation into whether I feel like that I can take care of them with like this, basic support, or if I need to direct them to one of my behavioral health colleagues.
Well, so let's stay there for a while, because I know there's traditional healthcare, and as a specialist, you can be a little tunnel vision. So for those people who are connected to larger systems, or those who are just in more of a larger private practice but not multi-specialty, what would you say to them, or how would you advise that men should be screened regularly in, for example, a urologist's office for depression or anxiety?
Well, if you want something formal, then there are screening questionnaires, and that most of us have moved to electronic medical records, and most of those records have built-in screening questionnaires for depression, for anxiety, for a myriad of health conditions. So I would recommend checking to see what you have available in your electronic medical record. Also, I just think that I think that it just is good practice to just have in your armamentarium of clinical resources, to have a behavioral health professional in your circle, so that when you have a patient that you identify may be depressed, may have anxiety, may have something that they can benefit from their sources, that you have someone you can refer to. And also, I would encourage that, behavioral health professionals, that, you should have, you should have a good referral base of not just primary care doctors, but also the specialists, of surgeons, because we see those patients, particularly when I'm dealing with cancer. That is very, that can raise a lot of anxiety and depression, and the kind of care that they need for that area is at times outside of our expertise as surgeons or primary care doctors, and they really do need the help of a behavioral health professional. So,
it's interesting what I'm hearing is that yes, the urologist is a very specialized field, but there's a lot of primary care there, and I think when men present with erectile dysfunction or BPH, is there an opportunity to develop a relationship with the psychiatrist or the psychologist, social worker, where patients are referred because of anxiety or depression?
I have, in my professional circle, I have a psychologist and psychiatrist that I have worked with for my cancer patients, for my sexual dysfunction patients, that I just know they have the expertise in that area, and my patients are going to benefit from. And I actually end up we end up developing a action plan together, because, for example, I have a lot of young patients who are under 40 with erectile dysfunction, and for the most erectile dysfunction in that population, it is psychogenic, meaning that it is nothing organic. It's nothing from like having high blood pressure or diabetes. It really is a lot of behavioral components to their dysfunction. So I will end up sending that patient to one of my colleagues in behavioral health, and then together, the three of us will develop an action plan that is a combination of medication, counseling, behavioral therapy, et cetera, so we can optimize the patient's outcome. And it's generally very effective, and the patient is very appreciative of that double-fisted assistance.
Okay, thank you. Final question. In the creative thinking realm, what else can the urologist do to improve access to care, or improve lifestyle, improve inadequate health education or lack of awareness?
I think that a great opportunity is that, after COVID-19, we have really engaged with the technology, with telemedicine, and I think that unfortunately, people are living a large portion of their lives on this media. And I think that when I look out in the community, that a lot of my colleagues are still kind of playing catch up in that aspect. And I think that that's a low hanging fruit to approach. I understand there may be some cost barriers that's there, but I think that this having an online presence, either with a website, either with I hate to say this, even at TikTok, or just even like posting videos similar to what we're doing. I think that people, I think that is an important avenue that people are using to engage in healthcare, and I can imagine that as Generation Z and the millennials get older and begin to have those medical conditions, have more medical conditions, that they're going to use this medium for a lot of their healthcare, whether we like it or not. And I think that we set ourselves up to be the most effective agents for our patients when we try to be present and have some presence in most of these channels.
Yeah. Meeting them where they are, I would agree with you. It will take some thinking outside the box. Do you have any final words for our audience?
I think that in general, I'm happy that there's a June. The June is Men's Health, but I think that we should have every month. We should think about our general health, and we should, make sure we have to get regular doctor appointments. Make sure we're taking care of ourselves, and also make sure we're taking care of the men in our lives. A lot of us, we see fathers and friends who just are not taking care of themselves. And I think a simple asking, like, when the last time you went to the doctor, would go a long way, coming from someone that they know cares about them.
Well, thank you again. We are our brother's keeper. Thank you for taking time out of your busy schedule, Dr. Winston. We really enjoyed this conversation that I'm having with you. We hope that you have enjoyed the support discussion as well. For more information, please visit msdc.org and look under for physician. Also, for more information on our WOW series, visit msdc.org/WHOW. Again, thank you, Dr. Winston. Enjoy your day.
Thank you.